My name's Edward O'Connor, and I'm a 60-year-old man, native New Yorker my whole life. I am married with 6 children and one beautiful granddaughter. I have spent my entire working career in the financial service business. I feel I'm very fortunate to have met Dr. David Samadi. I was diagnosed just before Thanksgiving 2011 with prostate cancer. I had had very, very high PSA level. 7 out of the 12 biopsies had shown extremely high Gleason scores. What I started to do then was to look at this and to do my research on this and find out who would be the best doctor to help me, the best doctor to solve my cancer problem. I went to every doctor in every major cancer center here in New York. After seeing all of them, one name kept coming back, and that was Dr. David Samadi's, and I actually saw him last. When I saw Dr. David Samadi, the thing that impressed me was that he was both a urological surgeon and also a urological oncologist. During the course of Dr. Samadi checking me and seeing exactly what he was up against, he determined that, lo and behold, I also had bladder cancer. Had it not been for him, and by the way, none of these other doctors were able to diagnose that, Dr. Samadi was able to treat me both for bladder cancer, for the prostate cancer. I knew if I needed further oncology, he would be the person. One thing that I learned also, which I couldn't believe when I learned it, was that most of these other doctors do not do the entire operation. They are leaving much of the operation to their assistants and residents. I was stunned. How do I know this? Because again, I went back and I asked them point blank, do you do 100% of the operation? After a little, well, maybe a little, they wind up saying, no, what happens is I have the assistant, he'll maybe start it, I'll do the important stuff, and they will have somebody finish up the project, finish up the operation. Dr. Samadi is there 101% in that operating room every minute that I'm in the operating room. Is that impressive? Yeah. Is that one of the reasons why I said, this is the man that I must have treat me? People ask me a lot, why did you go the surgical route to treat your prostate cancer rather than radiation? I looked at both of them and saw several people who are true experts in radiation. After doing the research and thinking about what would be best for me, there was no question doing the surgery was better. Here's why. If for some reason prostate cancer had left the prostate gland and gone into another part of my body, after the surgery, there are still several options on what we could do. We could still do some radiation treatment. We could also do hormone therapy. The problem with doing the radiation first is if you then experience the prostate cancer leaving the prostate gland, now you have a problem, because now doing a salvage prostatectomy almost will assure you that you're going to have problems with both your sexuality and incontinence, almost 100% guaranteed. Another thing that I had been concerned about, not just with the continence, but then was sexuality. And would I be able to have an erection, and would I be able to have sex? I would say that probably within a 30-day period, I was able to start to have an erection again. That, coupled with the caringness of both he and his entire staff, just made me feel more at ease. I didn't know that Dr. Samadi was a medical host on Fox News until after I had made the decision to have the surgery with him. The funny thing is that my brother Dan had said to me, perfect. He said, it's just like your mechanic. You want the guy who's going to work on your car on the weekends to write articles for Popular Mechanics, immersed in what they do. For Dr. Samadi to spend his spare time, his off time, effectively still doing work, this is a lifestyle for him. Caring for people, medicine is not just a job. This is not just a career for him. There's no question in my mind that it's a full-on lifestyle. This is who he is. In his spare time, he winds up being a commentator on all kinds of health subjects, which also means it only makes him a better doctor, because he has to be on top of any health trend that's going on, any type of new diseases that may be occurring. It makes him a better doctor, and I think it just speaks to the person who he is. He is 100% all in.